properly treat yourself with self-care, you have to have a little bit of an understanding of the structures that we're dealing with, the muscles that are really tight, and the bones of the skull that are affected by the tightness of this TMJ. So I'm just going to take you very briefly through a couple of illustrations and graphics so that you can kind of visualize what's going on when you're suffering from TMJ dysfunction. Let's take a look at the muscles and how they're affected. There's the joint there. There is the masseter, and there's the temporalis muscle. All of these get very tight with TMJ dysfunction. Here's a skeletal view. The joint again. There's the temporal bone, followed by the parietal bone. There's the sphenoid bone. There's the mandible. Then there's the angle of the mandible. You see the angle comes out at about a 90-degree lift there. Keep that in mind. You want to remember to go 90 degrees out in the self-care technique I'm about to teach you. So this is our demonstration here of TMJ self-care. As you can see, I'm finding the TMJ joint right here. You're going to want to feel for that tightness, feel for that ridge that we just saw in the diagram there. First thing we're going to do is compress, and we want to remember to compress up. As you can see, my fingers are in the joint compressing up towards my head. Once they go all the way up there, I want to readjust. I want to find that groove again. I want to find that tightness in the muscles and tissue around the joint. And I'm gently going to compress down now. Just really starting to alleviate that tension. You can even see in my eyes there as I start to zone out. It's a very nice relaxing feeling. You're just going to want to follow that tissue very gently all the way down. As you can see, you can barely see my fingers move. These movements are very, very subtle. The tissues that we're dealing with are very small in the structures themselves. We're going to follow that all the way down to the mandible. Remember we talked about the mandible in the earlier section. And when we get to the mandible, you feel kind of like that right angle right about there. You're just going to want to do a 90-degree tilt right off. I'm going to show you now from the side angle pretty quickly here, but you're going to want to go a little bit slower. As you go all the way down, get to the angle of the mandible there, and just let it go. Pretty easy. So thank you very much for tuning in, and I hope that you have found the TMJ self-care informative, and I hope it will help to ease any TMJ dysfunction or discomfort that you have. Remember, if you're in the Chicagoland area, Jase Therapy would love to see you as a massage patient or craniofacial patient. You can schedule them online at www.jasetherapy.com, or you give us a call at area code 773-510-8930. Namaste.
Here's what to do if you are not able to visit Jase Therapy. Bruxism-teethgrinding.com can offer you an holistic exercise program. Simply click on a button or link below this video. If you're watching it on YouTube or another video channel, press the blue link either below the video or right beside